Yes, I would like to talk about those things. But first, I want to just say I'm really privileged to be speaking on behalf of the editorial board and the associate editors of Pediatric Quality and Safety. It's a team effort, and their work is very much reflective in the kinds of results we're getting in our publications and the quality of our publications. I am a pediatrician and pediatric intensivist. I did all of my training at Cincinnati Children's Hospital in the 70s and 80s. I spent 10 years in the Navy as a general pediatrician and directed an ICU at the Naval Hospital in Portsmouth. I was the medical director of the ICU at Cincinnati Children's for 15 years and the chief medical officer at Nationwide Children's in Columbus, Ohio for a 12 years period. I spent a lot of my initial time as a clinician, but over the past 10 or 15 years, I've focused on quality and safety and have had the privilege of publishing more than 150 manuscripts and have led several large 50 to 100 hospital QI collaboratives from project eliminating bloodstream infections in 50 hospitals to a pediatric sepsis collaborative in 50 hospitals focused on improving pediatric sepsis outcomes in children. My work has mostly been in hospital administration, nosocomial infections, and of course, quality improvement. Well, what excites me about the field of quality and safety and pediatric quality and safety is it's become mainstream. And I say this often when I have the privilege of giving talks. When I started in quality improvement 25 years ago, you were kind of an oddball. And now for people that are not doing quality improvement, you're a little bit out of the mainstream. So I'm very happy that quality improvement science and work that tries to drive outcomes is now mainstream, because it certainly wasn't that when things started. Impetus for starting the journal was because we saw a gap in the academic productivity associated with publishing quality and safety. First, people weren't doing quality and safety, and those that were had limited places to publish it. And so getting the journal started back in 2016, where we focused on publishing just pediatric quality and safety for people to focus on this work and be able to see not only the kinds of work that is available to read, but also how people drive change in their own institutions for the readership to view. Well, the kinds of research that we're looking to publish are several themes that are important. We think that now population health is a really, really important theme, and we look for papers in that domain. But of course, safety, hospital-acquired harm, medication errors, pathways, those kinds of things are important to publish. But we're really interested in high-quality manuscripts that take a project from start to finish, describe to the readers how they did that using quality improvement science. And it's less about the themes and more about the novelty of the topic and the way that the writers and the readers can connect and understand how you can take a particular project that they see in publication and implement that same project in their institution, so that not only does the academic work get the word out, but it also gets the word out in a practical way so that others can take the same kind of project and implement it in their institution. Therefore, the manuscript needs to have enough detail in it so authors, so that readers can see how they could reproduce that work in their own institution. And ultimately then, the spread of new ideas becomes a very practical way to drive outcomes across the readership, but across the country and internationally as well. I think there are several benefits for authors to publish in Pediatric Quality and Safety. I think first of all is our philosophy about the kinds of papers and how we get papers to publication. What I mean by that is we are focused on helping through the peer review process authors to understand how their paper can be succinct, well-written, and get their point across. And sometimes that requires multiple revisions, which is not always the case with other journals. So we're very patient with the kinds of drafts that come in as we try to work with authors and give them education about how to publish a high quality pediatric quality and safety paper. Of course, the second thing is that this is a pediatric focused journal. Therefore, the audience is going to be primarily readers interested in pediatric issues and pediatric quality and safety issues. And I think that's a very important, it narrows down the readership to the kinds of folks that are going to be interested in reading about this work. And last but not least, and this is, I don't know if it's unique, but it's certainly, I think, uncommon. We don't charge APC charges for the publication of papers. We have a grant from an institution that supplies a payment for the APC charges. And I do think that that makes it more economical for authors who want to publish online in that they don't have to pay APC charges. Well, writing a good manuscript is both a science and an art. We find that there are lots of opportunities for writers to be more succinct and focus on the grammar and English that they use to do their writing. And so very, very important characteristics is that the paper be organized, well written, with proper grammar and syntax and clarity of thought, and that the idea of the project is novel. It doesn't have to be completely unique. It can be a paper that describes work that's been done by others, but has a uniqueness to it that allows the authors to describe how their papers may be different than what others have done. As you organize a manuscript, because I mentioned that earlier, it's very important to have in the introduction a context for the readers to understand why this is important, and finish the introduction with a specific aim, or at least an aim or goal of the project, so that the readers then know what's coming in the rest of the manuscript. There is a paper called the Squire Guidelines, SQUIRE, that describes how to organize a manuscript for publication focused on quality and safety. So we really expect and hope that the authors will use the Squire Guidelines to organize their paper. Importantly, we don't want to publish pre and post papers, meaning you take a cohort where there's a pre-group and then a cohort where there's a post-group. We're interested in publishing papers that use quality improvement science and look at data over time. One of the problems with pre and post papers is that you can often show statistical significance in a pre and post cohort that is not present, or maybe is present if you use QI science. So we're looking to see data-driven manuscripts that maybe use QI tools such as Pareto charts and aim and key driver diagrams. We look for both of those. And then the data needs to be analyzed not just with traditional statistics, but rather using analysis of data over time, an interrupted time series, using statistical process control charts, which allow you to see changes in outcomes over time, as opposed to just a pre and a post cohort. So I think those are characteristics that make for a strong manuscript. I do go back to my introductory comments there. It needs to be well written with good sentence structure, and we focus on that. And in fact, in the final editor review, we will send back a micro detailed edited copy of your paper with the various grammar and syntax opportunities for the authors to use, so that we have a well-written, organized, easy to read, and succinct manuscript. I think that the journal has been doing a good job of getting high quality academic work published, but we see opportunity to take that even further and get more publications from not only the United States, but all over the world. We think that the quality of publications can be used to drive change, and the number of publications, of course, is important for that. But we do feel there's an opportunity to grow our breadth and depth of the papers that come to the journal from all over the world, as opposed to primarily in the United States. And so we look to see that happen and grow significantly over the course of the next few years.